So for the heart, on the outside, you need to know the top of it is the base, and then where it comes to a point at the bottom is the apex. Okay? Same thing on here. This is the base, this is the apex. The vessel right at the top is the aorta. This, I think, is brachiocephalic, but it's not on y'all's list, but you do have to know aorta. This is the pulmonary trunk that's going to be at the front. And same thing here. This one is the pulmonary trunk. It's already dissected. Okay. Now, if you look right here, this groove, this is called the interventricular groove. The tissue, the heart tissue, is on the outside is called the epicardium. It's also called the visceral pericardium. Remember, for the thoracic and abdominal cavities, the organs, it was visceral peritoneum, visceral pleural. Well, this is visceral pericardium or epicardium. Now, I don't remember which one is on y'all's list, but you know, you may see one on the list and one in the book. That's the same thing. Now, y'all don't have to know the oracles. If you look at the back, I messed up. This one's a better one. Oh, well, this one is cut. This is the whole tube is both the superior and inferior vena cava. Vena is a vein. Okay, I like to have one where you can kind of put your finger in there. Yeah. So I have to use the probe. You can see it's like one continuous tube. Okay. So remember, the blood that's coming from the top of the body is going to enter into the heart through the superior vena cava, so this vein at the top, and the blood like coming from your feet, your legs, that's going to come in through the inferior vena cava. Okay, that's going to be at the back of the heart. Go back to the front of it. All right, let's see where you can see it better. Okay, it's kind of torn up, but like, all right, where my finger is right now, that's a pulmonary vein. It's going to be bringing blood from the lungs, dumping it back into the heart, right here. And remember, arteries carry blood away from the heart. Just think A away, arteries away, and veins dumping blood into the heart, carrying blood to the heart. Okay, now the inside. The muscle of the heart is called the myocardium. So all of this is the myocardium. Now, if you look within the atria and ventricles, within those chambers, it looks smoother. That's also muscle, but that one's called endocardium. So endo, think in the chambers. So endocardium, myocardium. Okay. Now, this piece of myocardium that's separating the left and right chambers, that's called the interventricular septum. So septum separates left and right. All right. And then the chambers, the atria are going to be at the top, and the top and bottom are divided by these valves, which we'll talk about, but the atria are at the top and the ventricles at the bottom. Now, the way you tell left from right is by looking at the walls of the muscle. You can tell on this side it's much thicker than on this side. Okay, same thing here, it's much thicker. The thicker side is the left side of the heart, and that's because the left side is going to be pumping blood throughout the entire body from top to bottom. The right side, the blood that's leaving the right side, is only being pumped to the lungs. The lungs, they're right by the heart. So the right side doesn't have to work as hard as the left side does. So the left side, the muscle is going to be thicker. So remember, you could have the heart like this and have some stuff pinned here. Okay. So like if this was pinned above the valve, you wouldn't want to put left, even though like that's how we're kind of talking about it now. Remember, that's the right side. You know. Alright, or even looking at it this way, since this is the cow heart, the left, and it's your right. Remember, when you see that thicker wall, that's the left side. Same thing. This is thicker, that's the left side. Okay, so let's kind of look at this one. You can see it better. So right here above, because I think if we close this heart, this is going to be at the top of it. Okay, so this is going to be the left atrium, and then right here, the valve. This cusp of tissue on the left side is the bicuspid or mitral valve. It's connected to chordae tendineae, that's our heartstrings. And then the chordae tendineae is connected to papillary muscle. So the area below this valve, this bicuspid valve, is the left ventricle. So the left atrium, the left ventricle. This is the bicuspid or mitral valve, the chordae tendineae, and the papillary muscle. And on the right side, it's the same way. This heart isn't dissected to where you can see it very well. You'll have to lean over. I'm gonna have to dissect it some more. But we have other hearts where you can see it. This one's kind of torn up. But on the right side, the valve is called the tricuspid valve. The little strings are the same thing, chordae tendineae, and the muscle where it's attached right at the bottom is the papillary muscle. That papillary muscle, when it contracts, it pulls on those chordae tendineae, and that'll pull the valves open, and that allows the blood to flow through. Let me see what else I wanted to say. Let's see. Okay, on the right side, you'll also find the pulmonary semilunar valve. You can see a piece of it right here. It's kind of torn. Now you have a pulmonary semilunar and an aortic semilunar. The semilunar valves do not have chordae tendineae like the mitral or bicuspid and tricuspid valves. Okay, so the valves between separating the atria and the ventricles, those are atrioventricular valves between atria and ventricles. Those valves have chordae tendineae. Semilunar valves don't. So this one you can see well. This is the aortic semilunar valve. It has no chordae tendineae, okay, but it's going to help keep the blood flowing in the direction it should be. This aortic semilunar valve is going to go run to the aorta. So, all right, sorry if I flicked you. This is the aorta, remember? I'm going to put the probe through the aorta, and you see it comes out by the aortic semilunar valve. So when blood passes that, the blood is then going to go up into the aorta. Same thing for the pulmonary semilunar. So, okay, you have to look in there. Do you see the little folds of tissue? That's the pulmonary semilunar valve. That runs into the pulmonary trunk. Can you do me a favor and push my sleeve up? Yeah. Thank you. That's good. All right, so, see, this should be all the parts. Let's run through it again. Oh, when we talk about the pericardial